So hyperaldosteronism is when you have high amounts of the aldosterone hormone. All right.
Continue. There is a hormone called aldosterone. Its job is to regulate salt and water in the body. It affects blood pressure. Hyperaldosteronism is an endocrine disorder that involves one or both of your adrenal glands creating too much of the hormone aldosterone. This causes your body to lose too much potassium and retain too much sodium, which increases water retention, blood volume, and blood pressure. The main symptoms of hyperaldosteronism is hypertension. It can range from mild to severe. Hypertension symptoms include headaches, dizziness, vision problems, chest pain, and shortness of breath. The other main cause of hyperaldosteronism is hypokalemia, or low potassium levels. Moderate cases of hypokalemia may cause fatigue, muscle cramps, which happens when you hold that position for a prolonged period, increased thirst, increased urination, muscle weakness, and palpitations. There are two types of hyperaldosteronism, primary and secondary. They have similar symptoms, but their causes are different. Primary hyperaldosteronism is caused by a problem with one or both adrenal glands. Some people are born with overactive adrenal glands, others might have it due to a benign tumor on one of the adrenal glands. A tumor is an abnormal mass of tissue that forms when cells grow and divide more than they should, or do not die when they should not when they should. And benign means without cancer. Adrenocortical cancer, which is rare, glucocorticoid, remediable aldosteronism is a type that runs in families, and other types of inheritable issues that affect the adrenal glands.
Where are the adrenal glands located?
Above your kidneys.
Oh, I see. So they bring in the excess waste to the kidneys, or do they push it out to the
above your kidneys?
Oh, so they're separate organ.
They're separate organs that
I see.
that control
I thought
hormones.
they were part of the kidneys. My bad. Okay.
So cortisol, that's all regulated by your adrenal glands. Pain regulation.
Adrenal glands.
They release hormones. Yeah.
Yeah. They're the main thing that.
You got lag.
Is my voice clear?
Yes,
hello.
It's clear now.
Yeah. Yes. It controls the blood pressure. So if the blood pressure is too low, the adrenal glands would send out aldosterone to increase the blood pressure. And yeah.
And there is the secondary hyperaldosteronism. It is caused by something outside the adrenal glands, usually to reduce blood flow to your kidneys. Several things can cause this, including a blockage or narrowing of the renal artery, chronic liver disease, heart failure, diuretic medications, which are medications that increase the production of urine.
Okay. So how is it diagnosed? We talked about the symptoms of hyperaldosteronism. If any of the symptoms are there, you need to check with if any symptoms of hyperaldosteronism are present. The patient has to get blood tested to make sure that everything is okay. But it needs to check, especially for the levels of aldosterone, which based on the disease, you have too much aldosterone. If they say check your blood and you have too much aldosterone, then you have hyperaldosteronism. And renin, this is like, I don't know how to describe this, but it's like the hormone that Renin helps release this aldosterone, and if the levels of renin are low, then you have too much aldosterone in your blood, and that way they can identify that you have hyperaldosteronism. An enzyme released by your kidneys that works with aldosterone to help balance blood pressure. I talked
So
about this.
aldosterone regulates blood pressure. Does it increase it or decrease it?
Increase. It
And
balances it. It's about balance. If it's too high, it
It
won't
affects
make
the blood
then what
pressure.
about renin? What does renin do? It says it helps balance blood pressure, but how does it help?
released by aldosterone. They work together,
I
as
see.
it says here that renin, an enzyme released by your kidneys that works with aldosterone to help balance blood pressure. Does that answer your question?
I guess so, yeah.
All right. People with hyperaldosteronism generally have low renin levels and high aldosterone levels. This can be taken in by your blood tests. We will hopefully show a video that helps to explain this whole process. Any questions so far? Good. All right. Next slide. All right. There's different types of blood tests that the doctor runs on patients with hyperaldosteronism. Blood tests are captopril challenge test. This measures exactly how much aldosterone, renin, and other levels that may have received that after you received a dose of medication called captopril. They give you a medication and then they test your blood levels. A saline infusion test. They measure they do a blood test after receiving different kinds of solution called IV sodium. Salt loading test. They do it following a high sodium diet for 3 to 5 days. Flodrocortisone suppression test. This is similar to salt loading, but the difference is it includes taking fluorocortisone, an oral steroid that mimics CT and MRI scans of the abdomen. Where anyone remember what we said? Where the adrenal glands are? Anyone know where the adrenal glands are?
Which glands again?
The adrenal glands. Adrenal.
If I'm not really sure, but I know that I think they're above the kidneys, like the things above the kidneys.
Yeah, exactly. They are above the kidneys, which is near the
Oh, okay.
abdomen. So if they want to test for high aldosterone, they can scan the adrenal glands using MRI or CT scans, and see if there's a tumor in the adrenal glands. If there's a tumor, that might be a sign that you have hyperaldosteronism. And adrenal vein samples. Also taking a blood sample directly from of each adrenal gland and testing the amount of aldosterone in it. If blood from one gland has significantly more aldosterone, you may have a benign tumor on. So they take the blood sample directly from the vein that is attached to the adrenal glands, and they test like Safi, the how can I say this? The fresh sample from the adrenal glands that hasn't been changed a lot, and see the components of it, and see if you have any problem that comes with it. Next. Okay, how can, if, let's say a patient hyperaldosteronism, there's too much aldosterone in the blood. What should happen to this guy? What can he do to fix the situation? Treating hyperaldosteronism fixes on reducing aldosterone levels. It is kind of like diabetes, if you think about it. It's all about controlling the levels of aldosterone, and we know that aldosterone increases sodium reabsorption and it increases potassium and hydrogen secretion. So to have symptoms that come with it. As if there are ways to treat, make that the levels of relatively balanced. So you can change. You may have lifestyle, eating healthy, exercising, reducing alcohol, caffeine, and quitting smoking. These all.
Mohammed, you're breaking up.
Oh no. Is my Can you guys hear me?
Yes, very.
Yes, just sometimes there's intermittent interference and your sentence trails off.
Okay. Well, if my voice cuts out again, tell me so I should probably change the Wi-Fi.
Okay.
If it breaks off again, please tell me so I can change. All right. It's like diabetes, the aldosterone levels, like you need to balance the glucose levels in your blood. Lifestyle changes would help in balancing the levels, but if it gets your level, you might need medication or surgery, which has risks to it. All right, next slide. Okay, what complications come with hyperaldosteronism? But are you at risk of if you have this disease? Why is this disease even dangerous? Well, first of all, it increases the risks of having a heart attack or heart failure, because there's too much sodium in the bloodstream, not enough potassium, not enough. It can damage the heart because it's the blood. Strokes. If anything happens to the connection with the blood from your brain, you could be at risk of a stroke. And because it messes with the blood pressure a lot, and the kidneys filter out your blood, it might result in kidney failure. So all of these things, hyperaldosteronism puts you at risk of all of these things. If a patient wants to avoid complications, he needs to change his lifestyle choices, his diet. He needs to exercise more. If he's eating anything unhealthy, he needs to do it before any complications occur to him. Yeah, make sure to follow up to check for any changes in your blood potassium levels as well. So yeah, just make sure everything is okay. Can someone live with hyperaldosteronism? Is it exactly like diabetes? Well, as I said, there's a there's a lot of similarity between the two diseases. The effects of hyperaldosteronism can lead to complications over time. The condition itself can be managed, just like diabetes. If you manage it right, you won't have a lot of complications, and you can manage it with the right treatment, medications, and lifestyle changes. For many people, the best plan involves a combination of surgery, medication, and lifestyle changes. Yeah. Next slide.
Thank you for your attention. It's the end of the presentation.